Welcome to the whole wide universe of cardiology. This is Dr. Jaitly. I'll be talking to you very briefly to help you understand what is cardiac rehab in this video vignette. Essentially, a cardiac rehabilitation is a supervised medical program for individuals or patients who have suffered either a heart attack or are ailing with heart failure or have undergone a PCI or a CABG, a PCI, which is a percutaneous coronary intervention or percutaneous transluminal coronary angioplasty, as it is called, PTCA. CABG, which is coronary artery bypass graft surgery, bypass surgery, or cardiac transplant to prevent another cardiac event from occurring in them. So it's a preventative medical supervised program in patients who have cardiac illnesses or have undergone a cardiac procedure in order to prevent another cardiac event. Now, it includes exercise training advice, a heart-healthy lifestyle, and adherence to a clean habit program. That means no smoking, no drinking, no drugs, and eating healthy and constantly exercising. So whole lifestyle modifications are being taught as part of this program. And the program normally lasts between 3 to 6 months. So it's very difficult for patients to enroll into a cardiac rehab program specifically so if they're feeling well. Like a person gets discharged after a heart attack, gets an angioplasty or a PCI, or has undergone a CABG or a heart bypass surgery and then gets discharged from the hospital, and now he or she is at home. For the next several weeks, there is a struggle in terms of how fast can the patient recover, etc., etc. And the spouse, the family, they're very supportive indeed. But the fact is that patient is not medically supervised, and he or she feels constantly, well, the person can make it and be able to get back to work, get back to lifestyle sooner or later. Well, the research and the clinical data is proving the otherwise. That is, if somebody is under a supervised program after a cardiac event, whether it is surgery, whether it is heart attack, whether it is even a stroke, even somebody has received a procedure like an angioplasty or LVAD, for instance, the left ventricular assist device, or even some stents, PCI have been offered. Those patients, specifically the heart failure patients and the heart attack patients, they benefit once they are enrolled into a medical supervised program called cardiac rehab. It is difficult for them to understand sometimes or get them convinced that, look, they're well enough and still want to be going to these programs. But even if they attend these programs for an hour and a half, 3 to 5 times a week, that gives them a whole dearth of information as far as what is healthy lifestyle for heart is. It advises also how well the illness is now being addressed, and that should there be any gaps in between where illness is not addressed, the chances are things can go wrong, and therefore one has to be very cognizant and very aware and vigilant about, specifically so about blood sugar, the cholesterol, the kidney functions, and the liver functions. Not only these blood tests are periodically done in this program, but also it helps understand both the doctor and the patient, specifically so when the patient is feeling well, about his or her illnesses. And it is so important that one really makes best use of the available resources from the cardiac rehab program, not necessarily just the doctor or the supervising physician alone, but even the nurse practitioner, the social workers, the dietitians or nutritionists involved, specifically so when somebody has diabetes and cholesterol, in addition to all these problems, which is fairly very common because obviously cardiovascular risk factor analysis, the assessments are periodically done within this 3 to 6 month period while the patient is enrolled into a cardiac rehab program of a good repute. So it is very, very important for us to really strengthen the fact that even while the person is feeling well, he or she should enroll into a cardiac rehab program in order to benefit, one, from the procedures, and two, also prevent the illness from recurring, or a coronary event or a cardiac event from recurring. Like the hospitalizations can be prevented. The heart failure patients, if they feel well enough and they stop taking the medications after a while, they get back into the hospitals with worse heart failures, and now the left ventricle function is even further compromised. So the stents, for instance, what are the benefits of the drugs, etc., that keep the stents open? What are the benefits of aspirin and antiplatelet agents post bypass, for instance? What is the benefit of keeping the anticoagulants going in the LVAD cases where you have left ventricular assist device in order to keep the blood thin? How important that is, because otherwise the conduits can get clogged, and next thing is you're going back into again for recurrent procedures. So all of this is really strengthened within this program, and the know-how, the education, the patient education, and employing all the tools to educate the patient and offer in terms of audio, video, and handwritten advice. That's an amazing way to really curtail or reduce the cardiac events from occurring in patients who already have cardiac disease. Okay, well, hope you enjoyed this section as well, and lots of good luck, and take care, and see you again in my next presentations. Bye.